dear friends. Today we are going to talk about is the symptoms of ovulation. So again in this video it is a very simple topic, but symptoms of ovulation are, yes, we need to know when we are keen to conceive. When you're trying to conceive naturally, as we talked in the previous video that how can we conceive naturally. So symptoms of ovulation, if we are knowing, then we can better try for natural conception. So what are the symptoms of ovulation? So generally, if you are having a 28 days cycle, that means your cycle is, or 28 days or 30 days cycles, that means your cycle is regular. So according to the literature, it is said that if your cycle is regular, that means you are ovulating. Generally, any woman who is having a regular cycle ovulate generally on the 14th day, or generally in the mid of her cycle. So generally the mid of the cycle is said as a highly fertile period. So you should have a natural contact during this mid of the cycle, that is from 11th day up to 16th day. This is called as a fertile period of your whole the menstrual cycle. After this or before this, you can try for the natural, you can have a natural contact, but this period you should not miss having natural contact when you are trying to conceive. Now coming to symptoms. Now first symptom is mild pain you can have in your lower abdomen when in the middle of the cycle when you will have the ovulation. So this is the very important point, that you will have a mild pain, because it is the most noticeable symptom that you can have. Now other symptoms that you can have is the breast tenderness, mild breast tenderness you can have. Other things is the change in the cervical mucus also, but this you need to have a watch on. That is there is a change in the cervical mucus. Generally the cervical mucus is thick. It is not very liquid. So when your ovulations comes near, or when your ovulation happens, this thick cervical mucus will change into a liquid type, or it will become more liquefied. So this is the again change in the cervical mucus. Then there is a change in the basal body temperature also. So this is the third change we will say. So in this, what happens is the basal body temperature is around 97 to 98 Fahrenheit. Now there is an increase in this temperature by 0.4 to 1 degree Fahrenheit when there is a ovulation. So there is a typical rise in your basal body temperature when ovulation happens. And there is also other methods which I will be talking, where you can track the ovulation. Now these are the basic changes in your body which can tell you that yes, this is the time when you am ovulating. Yes, when your cycles are irregular, that time it becomes difficult to know that when is your ovulation happening. For that, what you can do is, you can use is the first is the ovulation kit. In this, what this ovulation kit is based upon, generally it is that the LH kit basically they are. So the rise in your LH hormone during your ovulation gives rise to this, it is like a pregnancy kit. So they have a strip of 5 generally in that, and when there is your period of ovulation, that time you have to check just like a pregnancy kit, you have to check, and it will show if the ovulation has happened, it will show you 2 lines matching to the test line. So that will tell you that yes, the ovulation has happened in the ovulation kit. And more specific method other than that what I have talked about is the ovulation monitoring. Of course, for this you need to visit the fertility doctor, and you need to track whether the follicle is growing or not and it is rupturing or not. But my friends, the tracking of ovulation with the help of USG is most specific and most accurate method to track your ovulation. So in this video we have talked about ovulation, symptoms of ovulation, how naturally you can track ovulation, and with the help of doctor how you can track the ovulation. And ovulation is the very important step, because ovulation, if it happens, that is the release of the egg into the fallopian tube, from where your journey of conception begins. So thank you. I hope this video is informative for you, and do have if you have further queries, do have a contact with me. Thank you.